And action.
Are we in the training? Okay. The next thing we're going to discuss is the different padding that we have available for people that have a bunion deformity. What a bunion is, it's actually a bump that develops in this part of the foot, okay? And really what's happening is there's an instability of the joint here, and the two long bones are doing a separation, kind of like a peace sign. So when they get this bump, often patients will get discomfort from the nerve here, and often they'll get discomfort because the two toes start to rub together. So depending on what their painful symptoms are, we offer different padding. For those patients that are having discomfort here, if they're wearing a tight-fitting shoe that's causing discomfort, we use what we call a gel bunion sleeve, not to be confused with a gel bunion splint. This one actually has a little gel cushion in there so that when they wear the shoe it doesn't rub. And you're going to apply this over the big toe, just like that, and over the foot, and when they wear a shoe it should reduce that friction. Okay? Now if they're wearing a very, very tight shoe, it's not going to make a difference. It's just going to increase the pressure. So they need to understand that this is for friction relief that causes that type of pain. The other types that are available here are ones that are more related to the two toes rubbing together, all right? The way this one works, looks like a little anvil almost. It goes over that second toe, in between the big toe and the second, and actually underneath the little toe. So it actually does help a little bit with hammer toes as well, if they're having that pain at the tips of their toes. But more importantly, it keeps these two toes from rubbing against each other and kissing all day, which can lead to blisters and calluses. The alternatives, and obviously these require a closed-in shoe for wear, this is called a toe spreader. It actually looks like a little hourglass. And what you would do is you place that between the patient's toes, and they would wear that within their sock and in their shoe. And that also prevents the rubbing. Another alternative is this toe separator. This is the thicker version. There are different widths, different versions, so that you can kind of see what the patient likes. If they're not having a lot of rubbing, you just want some cushioning. There's some thinner versions that wouldn't be as uncomfortable at first. But it literally looks like a little Nike swoosh almost. You just slide that between, and when they wear their shoe or their sock, that holds that in place. And those are the padding for bunion deformity.